The promise of affordable health care for all is a hotly debated issue these days, and rightly so. Few issues are more complex than health care. It touches every American's life while also driving our economy. Increasingly, it's clear that the U.S. health care system is on an unsustainable path. Per person, we spend close to double what other industrialized nations do, yet we still have about 47 million uninsured Americans whose only medical option is a hospital emergency room. And it's such concerns that pack town hall meetings around our state. From packed church auditoriums to smaller civic clubs, democracy spoke up this summer.
Every community that I did an August town meeting 1 year ago and repeated with an August town meeting this year, the turnout was 10 times larger. Not 10%, 10 times larger.
Congressman Frank Lucas represents Oklahoma's sprawling 3rd Congressional District.
It's an amazing outflow of pouring of people, and they're not just political activists of one side or the other. In my small communities, I know all those people, both sides of the political spectrum. These people are overwhelmingly real folks, first-time attendees. They've never been to a town meeting before. That says something about what's rumbling across the countryside.
Which is predominantly concern over the future of U.S. health care. Representative Lucas was greeted at this stop with a rally by those favoring a public option.
Public option is an option, not a mandate. You can still have private insurance and your present coverage.
Gladys Allred is president of Stillwater's League of Women Voters and says, contrary to popular opinion, public options for health care are nothing new.
Public option is a government-administered program similar to Medicare, and Medicare has been around since the 60s, and we haven't become socialized medicine. We still have private insurance, and so this is an option.
But enacting a system that would cover all Americans could cost almost $1.6 trillion, an expense that has little support among Oklahoma's congressional delegation. Senator, in terms of health care reform, what is going to be the hardest on our economy, doing too much or doing too little?
By far doing too much, because the risk is when you do too much, you take what is good with our health care and hurt it in the name of fixing what is not good.
Dr. Tom Coburn has earned a reputation among his Senate colleagues for his work to trim federal spending and says it's a mistake to create more government bureaucracy when private enterprise works better.
80% of our health care is great. 20% isn't, and most of that 20% has to do with access based on way too high costs. And any bill that comes out of Congress that spends more money on health care is an abject failure, because what it fails to recognize is that we're spending twice as much as any other country in the world, even though we've got great outcomes, especially on acute disease management. We're not incentivizing the management of chronic disease. So the first answer that comes out of Washington, it ought to cost less, not more. And the second is we ought to make sure we empower what is working well to stay and address that which is not working well, which is prevention, wellness, and management of chronic disease. You start controlling those, that's 75% of the cost of health care. And so we can fix it, but you don't have to tear up the whole system to fix it, and you don't have to remove people from what they like in the name of fixing it. And so that's the real risk.
The whole of America starts participating and taking back what is rightfully theirs.
At a town hall meeting in Dell City, Dr. Coburn told the audience he favors a system with
real transparency and real competition in the insurance industry, and if that happens, we'll all get a better deal, including the insurance industry.
Views that have been attracting not just national, but international attention. Marion Schimlicher was part of a TV crew from Germany's ARD television network, attending this forum to ask about Americans' reluctance to support health care for everyone.
It's about how people judge this German system, because when I see it from the American perspective, I would say the German healthcare system is a bit like heaven. You know, if I go to the doctor here and I see the prices, I see how many people don't have an insurance at all, which doesn't exist in Germany. Everybody has an insurance.
Under the German system, private insurers compete for business under a tightly regulated system that is funded through a payroll tax. The unemployed are then pulled together while the elderly have their insurance paid for through pension funds, a publicly funded system that is privately driven, something U.S. Representative Frank Lucas says could be a model for reform in this country.
Since the 1870s, the German government has made a policy of trying to meet the healthcare needs of their citizens. Right now, as I understand it, they have a system basically where 400 plus companies compete for 40 million plus Germans' business. It's not Medicare, it's not exactly Medicaid, but it's making sure every citizen has a healthcare policy.
And a system that costs less than half of what we spend in this country. A United Nations study shows, per capita, the United States spends twice as much on health care than other industrialized nations, even though countries like Canada, France, Germany, and Japan cover their entire population while spending less.
That's what's important, that everyone have fair, equitable, and accessible health insurance.
A growing argument that the health of our nation may just come down to the health of its citizens.